Hi, my name is Megan Coleman. I'm a senior technical advisor for key populations at USAID. Previously, I worked as the director of community research for Women Walker Health, which is a federally qualified health center in Washington, D.C. There, I conducted a quality improvement project on integrated pharmacy and PrEP navigation services to support PrEP uptake as part of my doctoral project at the University of Alabama, Birmingham. The problem I was looking to solve as part of this project was focused on a PrEP program at that large community health center, Women Walker Health in DC, and really looking at increasing PrEP initial uptake of medication or picking up prescriptions from the on-site pharmacy. The goal of this 2-month QI project was to identify individual system and individual level barriers to PrEP prescription pickup. And its success was measured by a change in the average days between the initial prescription to pickup. And that was used to then develop targeted system level interventions and identify barriers to PrEP. Overall, we included 198 patients in the analysis, and 80 received a focused PrEP navigation as part of with the developed tool. We saw a decrease in the mean days from initial prescription to medication pickup. So that was reduced by 1.42 days. Additionally, the project resulted in improved medication pickup rates system-wide. This went from 75% to 83%. The project team, which was made up of pharmacy support staff, a quality improvement specialist, community health workers, the medical director, and myself, developed an evidence-based navigation tool, which non-medical clinic support staff could assist potential PrEP users in identifying and overcoming possible barriers to PrEP uptake and continuation. The tool is a short questionnaire that all patients who did not pick up their prescription within 7 days of their initial prescription from our on-site pharmacy were contacted. We asked if they had any barriers to facilitated using this very semi-structured interview structure. And then those were evaluated with the clinical quality improvement team. And those were used to create the second intervention, which was designed to address system level barriers using what lessons that were learned in the first cycle. Interestingly, going to the project, I'd envisioned that most of the barriers would have been external to the clinic, but many that we found out were traced back to the clinical system itself. And so we used those findings to develop that second cycle or second intervention itself, which was built on lessons learned. And this focused on staff trainings and system improvements on post-visit communication, which included detailed discharge instructions for prescription pickup based on the barriers that were identified in that PrEP navigation tool used in that first cycle. As part of this project, we also utilized weekly meetings that were already on the books for provider updates. And as part of those, we would introduce the findings, and then the providers themselves would come up with possible solutions for identifying some of these issues. This resulted in improved discharge instructions for how and where to pick up medications, and the idea to have real-time linkage to community peer navigators directly through EMR referrals. One of the strengths of this project is that it is really adapted from using evidence-based information to build this tool, but then that tool was further adapted to local context. So a small clinical quality improvement team could be incorporated in any system that can be at a clinic level, a health department level, a city health department, a state health department, and really identify the client journey for PrEP, because I think that was really the first step. And so understanding that PrEP process, I think, is really, really key to understanding and scaling up PrEP at an individual community, CBO, clinic, anywhere along the kind of spectrum that we have in the United States. So I think that there's a couple key takeaways from this project for me, which is one, the importance of looking internally within a system, within a clinic, within an organization before looking externally at times, because those are things you can adapt and things you can change, and they have maximum impact. The second thing, and I think one of the most important and vital pieces, was the role of the community and the community's ability to identify those barriers and those system level barriers to really monitor your own program to better it. so that the patient experience or the client journey or the PrEP client journey is maximized in both meaningful engagement, in outcomes, and is a better experience for everybody involved. And so having conversations, learning from our family planning colleagues, learning from others that navigate this choice discussion so well, really is that you involve the community, you involve family, you involve peers in whatever way is best for them.